Well, good afternoon, everyone. Welcome to another segment of Mental Health Moments. My name is Linda Golik. I'm the Health and Wellbeing Consultant here at Bellin Health. So happy to have you all with us today. You're in for a real treat. We, of course, have our usual master of giving us great nuggets to help us navigate challenges. This world that we live in now, Charles LaTorre. Charles, how are you today?
Very good. How about you, Linda?
I'm great. And today we also have a special treat. So also joining us today is Debbie Patz. And Debbie is actually our Director of Inpatient Services at the Bellin Psychiatric Center. So Debbie, thank you so much for being with us today.
Thank you. Thanks for having me.
Absolutely. So just to get us started, before we kind of dive into our topic today, we just want to really share that we want to reflect a little bit. This past October 10th was World Mental Health Day, and I know we really did an extensive session on that last year, and I just want to hear from the two of you, why is it important that we really recognize that day? What does that day mean to the two of you? And Charles, I'll start with you.
Sure. It means a lot to me, actually. It means to me more than anything that we hopefully, we still have a long way to go, but we're becoming a society that recognizes what I refer to as invisible illnesses. The invisible illnesses, things that we can't see, but are deeply impactful, deeply meaningful, sometimes deeply troubling for people. So there's a greater hopeful understanding and awareness around those things that we can't see, but people suffer from mightily. I know I probably mentioned this at one point, but we now live in a day and age way before we thought we would, but we live in a day and age now where depression is the #1 reason people become disabled. The stresses in our lives, the experiences in our lives, so many different things impact who we are and what we're about psychologically. So I think this is, in a way, society's, the world's way of saying we maybe haven't got it great, but we get it, or we're trying to get it. And this is now smack dab on our radar screen for us to deal with and work with. The other thing that makes it, to me, why it's so important is anything we can do to break through the stigma of what mental health is and why the stigma is such a barrier to treatment. Anytime we're doing anything to help that, we are doing, all of us, the world of good. I'm going to say one last thing, and that is, so October 10th is World Mental Health Day. And part of the theme this year was the inequality of access to treatment. So just putting that out there as something helpful to people and understanding that we still have a way to go in that regard is important. But the one other thing that I want to add is we are now in October. We just finished September, which was National Suicide Awareness Month. So anytime we are doing anything in mental health to raise awareness, #1, decrease stigma, #2, we are helping anybody who might be in that kind of situation, because the one thing we know, stigma and lack of awareness, lack of information, awareness and information is a part of suicide prevention. So all of this World Mental Health Day is helping in that regard and all of these other things. So because of that, I think it's of monumental importance and something that we need to continue to embrace. And just like I said, Mental Health Awareness Day is great, but in a way we need to make it every day. So that's where I feel we're at with it.
Absolutely, Charles, and I'm just so honored that we continue to work on this and to bring awareness to people by doing these segments every month. So thank you for that. Debbie, what does Mental Health Day mean for you?
For me, it really helps reduce that stigmatism. I think that's out there. And I agree with Charles. We've come a long ways, but we have a long way to go with that. The other aspect that I think is really important to note is that we are getting better at understanding how mental health is part of someone's overall health. And historically, I don't know that we've done a great job of taking that into consideration. And I think when we have opportunities to raise that awareness, such as the Mental Health Awareness Day, that really allows for people to unite and share. So many times in this line of work, we hear from others, and it's almost like, you'll be at a party or you'll be out or you'll be with a coworker and somebody will say, my sister-in-law really struggles with, impact OCD, depression, suicide issues. And they tell you this almost like this is something a secret on the side, but having a day dedicated to it really helps make it be more okay for people to express and share. And I think it's so wide, the different issues that people can have with mental health, that it allows them to be able to express that and then feel that support as well.
Absolutely. Thank you so much for that. So we'll continue to, really recognize that mental health is absolutely at the top of our priority list as far as really helping people live that better life. And so happy to have the two of you with us today. So this
Linda, can I just jump in on one thing? I think I want to double click for a second on something Debbie said, which I think is so amazing. And I want to underline that part in a way by capturing the flip of that. Because what Debbie said is so important and so super cool. This thing where when people get comfortable enough to talk about certain things and realize this is okay. This isn't necessarily a bad thing if I can voice this, because that sometimes is the hardest threshold to cross over from awareness to talking about it, communicating about it. One, if I have a problem, but as much as importantly, when it's a communication that we're all having, a conversation we're all having. But the flip side of that I think something like World Mental Health Day, and when we're all practicing healthy communication around mental health, we do something in the other direction, which is we don't minimize it. I'm sure everybody on this call, and there's a lot of harmlessness intended that, oh, I had my OCD moment, or I'm all ADD today, or I'm all this today. Oh, I'm depressed. This must have been a senior moment. When we do those things, they're sometimes humorous, right? And I know people don't do those things intentionally to make any, but if someone else maybe has that and you're making comments like that, sometimes it seems to trivialize their experience and make it seem like they're kind of making fun, even though that's the last thing anybody's intending to do. But when we could be more aware of our own language, the way we manage ourselves, we deal with those things with greater level of sincerity, a greater degree of seriousness and sophistication, and we're not making humorous slights about it, even though, again, they weren't meant to be intentionally harmful, but they can be in the presence of someone experiencing that. So I think all of that, again, put it all together in aggregate, World Mental Health Day, thank goodness we have it. Hopefully it's a stepping stone and way to build on these things throughout the year.
And that's such a great reminder too, Charles, I think for all of us, and that our language really matters. So we need to be aware of that, and the more aware of it we are, the better that we'll do in that way. So thanks for sharing.
It always reminds me of that one saying, we may forget what people said or did, but we'll always remember how they made us feel. So our language and our actions and our sincerity is what helps with that emotional experience. And when they feel a connectedness and understanding, that can only do well and good to help everyone. So there's a greater good element to it that we, in our own way, virtuously go to. So thank you.
You bet. Well, I want to open it up for our discussion that we're going to dive into for this month. So this month we are talking about let it go. Now, let it go can mean a lot of different things. We're going to talk a little bit about letting go of anger. We're going to talk about maybe letting go of some things that we can't change, maybe letting go of something that we feel like we have to do that we don't want to do. We're just going to learn how to let it go today. So it's going to be a really zen session, right? But looking forward to the discussion. So let's frame this up a little bit and talk about it. So Charles, help us understand what is going on in our minds that we do struggle to let things go?
Well, it's a really great question. And I think really jumps right into the heart of it. But when I hear that let it go, I almost, I was thinking we should maybe even have that song from Frozen on this, the Let It Go. I almost am at the point where I've heard that song so many times. Just hearing the phrase brings me back to that song. It's so catchy. So, but yeah, we are people not meant to let things go. When you really think about it, at the end of the day, maybe why it's so difficult to, and when we put just in front of it, just let it go. It makes it seem like, yeah, I should, but why don't I? And it's because it's so hard. Our evolutionary mind and brain are geared towards holding on to things, especially things that are threats. So the brain evolved to recognize, search out for our survival, our safety, to find environmental threats. Years ago, it was the saber-toothed tiger, hiding in the bush, that's going to get me, right? So I got to be prepared. I got to be on the lookout. I got to always remember where this is. And so I got to hold on to that. I got to Velcro that. We didn't even have Velcro then, but that was the holding on to it. We are people who hold on to negativity with such great sincerity because it's what we've been organized and orchestrated to in our minds to hold on to threat for our safety and to worry about threat, because we'd rather worry 1,000 times over, fret 1,000 times over for something that isn't there, rather than the one time that we didn't, and boom, there's the threat. So we hold on to that negativity, we hold on to threat, we hold on to anything that we feel is an injustice to us of some sort, and we hold on to that like Velcro, and we let positivity slide off like Teflon, because that's not keeping us alive. It might be great, it might be really fun, but at the end of the day, to survive threat, for our survival in our instinctive brain, we are more highly attuned and in tuned with threat and negativity, and then our justified anger, than we are some of the great that happens in our lives. So that's the science behind why we have a hard time letting go, but even more of why we need to. Because most of the time, if that anger is just there and we can't let it go, it's like what Don Henley said years ago in a song, that you keep carrying around that anger, it'll eat you up inside. So it even changes us. So that's what's going on. That's the science, what's happening, and what we'll get more into, what even more of why that's there and what we can do about it. So, but I'll pause there for now.
Debbie, anything that you'd like to add to that?
Yeah, when I think of letting go, I think sometimes too, from my own personal view, I picture, where I want my career to go, or what I envision my day will look like, or how my children should behave if we go out in public, or those types of things. And so I have in my mind a preset notion. And at times then when things don't go the way I thought they would go in my mind, that's a conflict, right? And how do you just let that go? I think it also speaks to being agile enough throughout the day, the workplace, at home, whatever it is, and recognizing that things will not go as planned, and then that we still have choices in those manners. And I think that's probably one of the biggest things that's really helped me in understanding a lot of things in the world. It may not be how I planned for it to be or how I envisioned or the way I thought it would be, but that's okay. And then to look for the things that maybe even went better than anticipated. But I do agree with Charles that it's not always intuitive to do that. It's not always natural to do that. But if you take the moments to do that, you actually appreciate some of the changes beyond what you ever could have anticipated. So there are some good things that happen when you let it go too.
So how do we, Debbie, you talked about having that expectation, right? Like, oh, I expect that my kids will act this way, or I expect that this is how this event will go. How do we work on that?
Yeah, and maybe one of the even more true to what some of the things that we're experiencing with COVID and the vaccinations, and we think about where that leads us. And I think for a lot of people who are working at Bellin and other places, think about what does that mean for me? And, in thinking about that, I think about even my own different thoughts on it, right? So I'm a mom and I'm a person and I have a RN background. And then I also have my role with Bellin as a director. And I think about those different areas and what that means when maybe a COVID vaccination is required. Or is that a good thing? Is it not a good thing? And it's not simple enough to put in buckets. But it's important for me to know that I do have a choice in how I react to it in all of those different venues, right? So if you're approaching me as a friend, how would I handle that versus when I'm in my director role versus when I'm in my mom role or whatever it is. And all of those mean different things at different times. But helping really let go is, for me, is that understanding of what are those choices. And sometimes it's literally taking a pen and paper and saying, here's the things that are not negotiable. Here are the things that are, and then what are the choices beyond that? And I have a choice in all of those. And those choices all have consequences, whether I like them or not, but it allows me to kind of start to sort through what that looks like. So we do that every day, every moment. We're making little decisions that probably are meaningless. But at the end of the day, there's some things that are pretty big decisions that we have to make. Do I marry this person? Do I not? Do I can get a new car? Do I not? And we think about all these decisions. And some of those bigger decisions, they really do take more time for us to process through and be able to recognize that I can get upset and stuck in the mud because it's really frustrating that I don't get to do what I want to do. But at the end of the day, I have a choice about how I handle that or what I do with that information. And so when you can kind of get past that bend and take that moment to reflect and help sort through some of those bigger decisions, it really does make a difference in the end.
Charles, you and I had talked about, and I love, Debbie, that you're talking about choices, because I think that's a great way for us to look at a lot of different things. If we're getting upset about something, really to take that step back and really reflect on, well, what is my choice here? What is my choice? Charles, you and I had talked a little bit about kind of understanding the why. So we talked about these 5 areas to help us understand maybe why we get angry or why we get upset, so that once we have that why, we can help ourselves process that a little bit better. Can you share those with us?
Sure, yeah. In fact, I think these are great to go through and they blend in with what Debbie was saying. And something that we've talked about before, I call it choice awareness. What, do we know when we're making a choice even? And what is the most healthy choice? And I'm going to go through these items because these are the type of things that if we don't know these and we're not dealing with them effectively, that choice awareness may go away and we may just make these instinctive things, which can be sometimes good, but other times maybe not as advantageous to us. So what we know from what the world of neuroscience tells us, I describe this as there's like 5 key things that the brain is so exquisitely attuned to that it probably makes up for, in my view, maybe even conservatively, 80% of all that we feel. Or at least when we're triggered in the way of anger, and it's difficult to let go of, one of these 5 things is typically in play. And when they're in play in terms of what I call a hit, we typically struggle. When they're in play in a really good way, we're typically in a much better psychological, emotional place. And those 5 things are that we're either hitting in a favorable or unfavorable way. The first one, status. The brain is remarkably, exquisitely attuned to status. And it's that social comparison thing, where I am in relation to the world, what's happening around me. So if anybody on this call thinks anytime they've ever been in a store and someone cut in front of them and they got a little bit angry, that's status. Anytime you've been cut off on the highway and you're thinking, I've got a behavioral message for you that has one hand involved in it, that's a status hit. That's anger from that status hit, right? Cut in front at Starbucks. Who do you think you are? That's a status hit. When we're doing great with status, we feel remarkably great. We are at one, we are in tune with the environment around us, right? The second one that the brain loves, the brain craves, the brain's always doing it, is certainty. The brain, being a prediction making and craving machine, always wants to know what's next. That's why when you're driving, it's like, is this person going to pull out? Are they going to stop at that stop sign? Is this going to happen? Is he going to say this? Will he not? I think I know what he's going to say, but I'm not totally sure. The brain, second by second, is continuously making these predictions and hoping for certainty in that prediction. But get an MRI and have to wait 3 days and not be able to predict and be in uncertainty, and wow, that's a very difficult place to be. We do great when we have some degree of certainty. We're not that healthy emotionally. We tend to struggle with the lack of certainty. The third thing the brain tends to love and strive for is autonomy. We love that we get to make decisions for ourselves. This is up to me. I don't want this made for me. All of those choices that Debbie just mentioned, the car. I want to buy my own car. I don't want someone else to pick it out. I want to decide what I'm going to wear today. Even if it looks terrible, I made the decision rather than had it made for me. The brain loves to have some degree of autonomy. And the next thing that it loves, values, craves, and feels good about is when we have good, positive relationships, right? People who value us, people who respect us, people who appreciate us, people we feel connected with, people who we trust. When we are in that positive side, we do great. When we get a relational hit, we struggle. That, how could you do this, man? I can't believe you did that. I can't believe you're breaking up with me. I can't believe this, whatever it is. And these things are happening left and right on social media, by the way. You look this, you're not enough that, this is this. There is relational hits all the way around. But then the last one that I want to hit in this process is we love fairness. The brain's exquisitely attuned to what's fair. It reacts totally with frustration and anger when we feel something's unfair. Anything that seems like an injustice, and this is maybe one of the greatest activating events for anger, because anger, when you really think about it, is really probably the most sanctimonious emotion that we have. We only feel really angry when that wasn't fair, and then we get all upset. If we find out it was, oh, okay, well, I didn't know that, we kind of back down altogether. But in the grand scheme of things, that fairness, there's people who'll spend their last nickel going to court just to make something fair and just. When that's gone off, we are incredibly emotionally hit. So to me, part of the key is, and by the way, if you think about these things, there's a guy who termed these SCARF, a guy named David Rock, a neuroscientist: status, certainty, autonomy, relations, and fairness is SCARF. So it's sometimes referred to as the SCARF model of our neuroscience and our emotionality. But what I find is the greatest thing is just having some level of awareness that maybe I don't have to be that upset about that. Maybe the guy who cut me off was driving his or her child to the hospital. Maybe there was an emergency. Maybe they just didn't see me. Maybe I didn't have my lights on. So we don't have to be as reactive to these things, with a little bit of awareness, a little bit of insight, and then a little sense of monitoring. As I always say, what we begin to monitor, we begin to modify. So it starts with some awareness, and that's why I'm going through these. So we have enough awareness to utilize that, begin to monitor, and then that can manage our reactiveness to life experiences. Because the one other thing I want to go back to what Debbie said that was so important is, and we've referred to this, it isn't just the experience, it's our coding of it. How we internally code that experience is really what we're reacting to. And when it's triggered on the negative side of that, we're hit. When we can manage that and not have it triggered or coded on the negative side, we react in a much more reasonable manner. And we're behaviorally more comfortable with that rather than feel triggered all the time. So there's more I'll even say of what we can do, but for now, I'll leave it there and see if there's any other comments or questions or anything, Debbie, you'd like to blend in with that.
Yeah, two things. The autonomy part of it, I thought it was really interesting because as you were describing before that, I thought, oh, this is going to be control, right? Like I like to have control of what's going on, but I loved the autonomy description of it. And I think it's much more fitting than the control of it, right? So I have autonomy. I'm able to make decisions on my own. And it's much more free flowing, I think. The other thing too that I thought about was I read a quote over the weekend, and I don't recall it specifically, but it was something along the lines that if we spent as much time trying to understand something that doesn't make sense to us, that frustrates us when we're in an argument with somebody else, if we spent as much time trying to understand the other side of it, as much as we do kind of fuming on, well, this is upsetting and frustrating to me, and I don't understand why they would want this or that. If we would spend more time trying to see others' opinions on it, perhaps we would have a better understanding overall. And I think there's a lot of truth to that, I think. And that's really some of the things that you were speaking to, Charles, is understanding that why. And so while my thoughts count, they're not the only thing that counts in all of the decision making. And I think that's a really important step to help understand and to start letting things go, right? So it's really important to me, but it may not be important to everybody else. And it's okay if I'm in the minority or my thoughts are different. It's okay for me to express them. And it's okay for me to ask others why they think differently, because it really does open our minds up to more opportunities and better understanding.
Yeah, so that is so great, Debbie. In fact, oftentimes one of the strategies that I ask couples to work with, co-workers to work with, anytime we're having that feeling, especially from a conversation and somewhere we're activated in one of those or with anything else, is if we can go inward rather than outward and be able to say, okay, whatever just happened, especially if I disagree with it, what might this person know that I'm not aware of? And how can I get a greater understanding and awareness of that? So rather than the immediate disagreeing and shooting it down and rebutting, going to that place of maybe I don't know anything and this might be a great way to find out. So going curious, I describe it, rather than going frustrated. When you can go to that place, it's really difficult to be incredibly angry and incredibly curious at the same time. So that's when we're activating that curious place. We're usually going to go somewhere in a more healthy, more directed place that's beneficial to us than the sanctimonious anger place. So fantastic stuff. Thank you.
And sometimes too, I think when I'm working with others, I'm one who, Charles probably knows this about me. I'm like ready to spew, like I've got a thought about that and, whatever. But when I'm working with others and something really takes me by surprise that it's so different than what I would have expected, I am trying really hard to pause and be able to say, tell me more about that. Or tell me your thoughts behind that, because it really does open up that discussion. And it also helps us realize it's okay to be different and have varying opinions on it. And it's not worth getting upset about. It's okay. It's sometimes we agree to disagree. And how do we still continue to move forward? That just carries that conversation on. But to be able to take that moment to pause and be able to say, tell me more. Oh, that's interesting. Oh, why do you think that? Or oh, where did that, I wonder where the background on that is. And people are happy to share the differences. And I find that sometimes even just pointing that out, you and I disagree on this, but tell me more about why you see it that way. And I always think it's just really fascinating to hear and better understand where other people are coming from. And it does really help with, our mind wants to go to this terrible place right away, and for whatever reason it jumps there, but really it's innocent enough, and it's just different thoughts.
Yeah, I got to say something because Debbie, I got to say this, Debbie is like so, what she just said is so much her. I could vouch for this. I was in a meeting with her and I was asked to do a little mini presentation impromptu on a topic, and I was going through it. And I was looking at Debbie, it was one of our earlier meetings, and I was thinking, wow, she is like, there's no reaction. And for a little while there, I thought, maybe she doesn't like where this is going or what this is, but she was so much taking it in. And then when the group was responding to some of that content, when Debbie chimed in, it was like, I'm just sitting here in this amazement and taking this in and how great this concept is. I'm like, wow, I'm so glad to hear that, because you were so in that place of absorbing that I wasn't sure how it was being absorbed. So I can totally vouch what she just said. She lives what she just described. Absolutely.
Well, and what a great tool, because I think it really shifts your focus. So rather than focusing on what you disagree on, or this is my opinion and I'm right about it, and so I'm angry that someone feels differently, but shifting that focus to, why do you feel that way? Help me understand. Tell me more about that. It really just diffuses it, in your own mind and in those conversations. So that's great. So let's then kind of shift to really helping people with some tools and some strategies. If they're struggling, if they find themselves to be angry a lot, or if there's things that they just really do have an issue letting go of, and they can tell that it's detrimental to them, either mentally or physically, what are the tools that people can start to work on to help them get into that process of letting things go?
Okay. You want me to go first?
Sure.
Debbie, you good with that?
Yep.
All right. So I'm going to say a couple, and then I'll maybe come back to a few and let Debbie chime in. But to me, there's really two pieces to this. There's what I call the in the moment, which everything we just described can be helpful for. Just knowing the SCARF model, knowing where you are, knowing your activating events. When am I most activated with status? When am I most activated with certainty? When am I most activated, and so forth, down to fairness? So that's one piece, is in the moment, frustration. But I look at anger and letting go as having two very distinct parts that blend together and actually help each other. So the first one is what I call the preventative thing. the preventative piece of it, that if I'm exercising every day, if I'm having helpful, fruitful, supportive conversations every day, if I'm stacking up every day, those in the moment things are going to be much more common, and I'm going to be more actively triggered all the time. But when my day is actually, wow, I feel pretty good. I started the day in a positive way, a breath focus, ended it with the breath focus, had some gratitude as part of it. I ate well, I hydrated well, I slept well. The way we take care of ourselves in life is a preventative way to, one, not even having that much to let go of and more to savor in the way of life. So there's that preventative element, which I think is key. And it makes, when we are in that moment, much more reasonable. Because let's face it, no matter how great we're doing all those things, we'll still have activating events. We're people, not robots, right? We will have things that trigger us. We will have things that happen. So then in that moment, it can be to take the breath. It can be visualize how I want to respond to this person, that one split second between reaction that's blind and response that's desired. That split second of awareness. And to me, the other key thing is knowing the triggers the best. It's and when you're running towards that, like I'm almost there, I describe it psychologically as like the dashboard on your car. So, my car has this thing, like it will tell you at 50 miles that you're going to need gas, right? So you're not doing so great, but you don't have to pull over. It will then tell me again at 31. And then at 11, if I've been ridiculous enough to do that. And it will also tell me when I need, like most people's cars, the dreaded service light. You need to go in. So what are your dashboard indicators in life? Like what might be happening to you, telling you, Charles, you only got 51 miles left. In this case, it's different. If you don't go for a walk, or you don't go to the Y, or if you don't do this, if you don't do a meditation, which by the way is one of the best preventative ones that you can do, and the breath focus daily as well as in the moment, sometimes even taking, I just need a quick 2-minute timeout. If I'm not getting recovery as consistently as I need to, have a dashboard that can tell you both when you're running low on your patience or your threshold of where these things are coming into play, as well as what you can do about it, and then you'll be better able to handle things in the moment. So I'll stop there and blend in a little bit, but Debbie, I can see that you definitely have a few things that you would like to highlight as well.
Yeah, actually, as you were talking, Charles, I was thinking my husband and I were just came back from a trip. And for any of you who may have been with a spouse or a friend on a trip, we reached this, are you hungry? Are you not hungry? Where do you want to eat? And it was this back and forth, right? And it got to be frustrating. And it was what it was, right? But it was this, like, I can tell this isn't going to end well. One of us is not going to eat at the right time or have whatever. And the reality is neither one of us cared, right? So along those same lines of what do you need to do, I think it's always good in the moment to be able to say, I need time to think about that. When you can feel that you're starting to get frustrated, or even spell it out. Like, I know that this is a topic that we're talking about that's going to be frustrating. Or sometimes it's even helpful for me to preface when I'm thinking about some of my coworkers, and it's a difficult subject about needing to stay or having to pick up shifts or whatever it is, right? So it's kind of like, I know that this is going to be sensitive, and it is for me too. Or I know that you and I maybe see differently on this, but here's what we're looking for, and here's why. I think all of those preventive measures are really good. It's good to be able to even call out and know where you are on this kind of scale of this is going to be upsetting or not. And then I also try to look at it from a larger perspective. So in the moment, it feels like there's nothing else going on but this one big thing that we're stuck on, or frustrated about. When really, when we think about the grand scheme, in 5 years from now, is this going to matter? Is this really something that I want to be known for? To Linda, we had this difficult conversation about whatever. Is it worth me arguing about what type of restaurant we're going to go to? I don't think so. It matters now, but it's still not going to matter in the future, nor do I want that to be what I'm known for. Or maybe it does. Maybe it honestly does. And I'm just going to be really vocal about this is where I stand on this topic, or this, I know I'm really passionate about it. And I know that I'm not going to be able to let it go easily. It's okay to spell that out too. But to be really self-aware of that, I think is really important for people. And that's something that we don't always take time for. And the other thing that I love that Charles touched upon is the gratitude. So when we think about in the morning or in the night, there's a lot of research around having a gratitude book, journal, finding 5 things to be thankful for, either waking up in the morning or finishing your day with. I think those coping skills, no matter how bad the day is, man, we can find something good to be thankful for. And it really does change our focus on it. You think about, sometimes I think about when the day's really hectic and then you get this phone call that your friend's, sick and all has to go through cancer treatments and everything stops. Your hectic day is no longer that hectic. It just really changes and shifts that perspective. And so I think to be able to have, again, that agility to be able to do that is so important. And if we're not able to, then what are those key things that we can do? That's a great start to be able to at least look back and say, yeah, what are 3 things again today I was thankful for? Or I'm going to wake up in the morning, 3 things that I'm going to try to do today for the good of others. And it never stops to impress me how much other people are willing to give and help out. And oftentimes that just goes unnoticed. And I think the more that we're aware of that, we think, okay, there's a lot of good out there and I want to be part of that versus stuck in the mud on something over here. So.
And I really just want to give a plug to our Lifesaver content as well. And actually in November, we're going to be focusing on gratitude. So you'll be sure to want to tune in and take advantage of those resources because we will be focusing on that. But I love how so much of this really does have to do with the dimensions of well-being and really looking at the different things that we can do to take care of ourselves so that we're that best version and we can respond more appropriately. My husband and I always have a joke about myself because if I'm hungry, if I'm tired, or if I'm cold, things are not going to go well. So he always kind of does a check-in. How are you feeling right now? Do you need anything? Are you tired? Do you need something to eat? So we kind of know each other in that way. But I think it's true. It's that those preventative measures that can keep us from getting to that point. And Debbie, I love what you say about will it matter in 5 years? Really thinking about that, and is it worth it if 5 years from now it won't make a difference? So we are going to run out of time here pretty quickly. So if you have questions for Debbie and Charles, please feel free to put those in the chat. Someone share amongst the awful, pause and think about what is good and also what I'm learning about myself and my strengths, how this is changing me for the better. So thanks for sharing that. So as we kind of wrap up here, just some parting thoughts from the both of you. So Charles, I'll begin with you.
I want to say 2 things. One, I want to give a shout out and virtual high five to the Bellin Wellness team. I recently heard someone talking about letting go because they had seen something at their place of employment while they were working out that anger and failing to letting go increases, and I may have the numbers wrong because I didn't actually see the flyer, but something like 2 times greater risk for cardiac disease and 3 times greater risk for heart attacks. So let it go. That we are highlighting this, I think, is awesome. So thank you for that. Please know it's helping people out there because I'm hearing about it in here. The other thing I want to do is I want to highlight a book. I don't know if you can see it, called Chatter. It's written by a professor at Michigan named Ethan Cross. And the thing Debbie was saying about, will this matter in 5 years? You could even do 5 days, but that very thing gives you emotional distance rather than immersion. It gets you less immersed and allows you to have emotional distance. And when you have emotional distance, you function in a better way, a more effective way than when you're so immersed, excuse me, that you're not really getting the full surroundings and full scope of everything going on in your life. That emotional distance, and this book is full of tools. The whole last chapter is devoted to those. But imagine when you're so caught up and something's right in front of you, but when you move it out, you can see it better, you can understand it better, you can respond to it better, and it broadens your horizon and perspective. So anytime you're able to do that, you will be going to a psychologically better place than when you get so immersed in that anger that you get rigid emotionally rather than experience emotional agility. So I'll wrap it up there and pass it on to you two.
Debbie, any final thoughts from you today for our audience?
I think, from my perspective, be passionate about things you love, know where you stand, know that you have choices in in everything. And is this really what you want the discussion to be about, or what you want to be known for? Is this subject, just know where you're at on that scale and that self-awareness, and that really will help go a long way.
Perfect. Great words of wisdom today from both of you. I really think we got a lot of great practical information to help us as we continue to get better at letting things go that we need to let go of. So thank you to the both of you for being with us today. We really greatly appreciate your time. Thank you to our audience. And we'll wrap it up and hope everybody has a great rest of the day. Thanks so much.